quick, anyone know what this little guy is right here? It is literally one of the most common reasons why mamas see me in clinic, one of the most common reasons we get visits in triage, and why mamas DM me in a panic thinking that something is wrong. It can literally stop you in your tracks. I'm talking about sharp, acute, slap you in the face type of pain that you see coming out of nowhere. I'll give you a hint. Also known as lightning crotch. If you guessed round ligament pain, you are absolutely correct. So in this video, I'm breaking down exactly what round ligament pain is, what it feels like, what causes it, and the simple things you can do today to get relief. I'll cover what's normal, what's not, and the one mistake that leads most mamas to suffer longer than they need to. And don't skip the ending. It can save you unnecessary fear and unnecessary pain. Before we go any further, make sure you subscribe so that you never miss an episode. Your prenatal care deserves more than scrolling TikTok and asking AI to calm your nerves. You need real guidance you can trust. By the way, I'm Dr. Tiffany Wittes, board-certified OB-GYN, sister on this journey with you, and your go-to for breaking down pregnancy topics in a way that's real, simple, and rooted in both wisdom and compassion. Let's get into it. First things first, let's talk about what round ligament pain actually is. Picture your uterus like a growing balloon. On the top sides of the balloon are strong bands of tissue, the round ligaments. They travel down through your lower abdomen into your groin and attach near the top of your pubic bone, near the top of the labia. Now imagine that balloon getting bigger, every single day. Those ligaments get stretched, pulled, twisted, even yanked. They work overtime to keep your uterus in the right position, and as your baby grows, they take an absolute beating. That's why even simple movements like coughing, laughing, sneezing, rolling over in bed, getting in and out of the car, on and off the toilet, standing up too fast can set off that sharp, quick pain. Round ligament pain is commonly described as a sudden, sharp stabbing or shooting pain, a quick jolt that stops you mid-step. It can leave a pulling or a burning sensation afterwards. It lasts usually about a few seconds to a minute or two, and it's triggered by movement and not rest. It can happen on one side or both sides, and by the time you even think, should I do something about this? It's usually already gone. It's uncomfortable. It's annoying. It's definitely alarming if you didn't expect it, but in most cases, it's not a sign of something dangerous. Round ligament pain usually shows up in the second trimester, but it can happen earlier, and let me tell you, each pregnancy can make it a little bit louder. Why? Because your body never fully goes back to its pre-pregnancy baseline. Your skin, your ligaments, your pelvic floor, your core muscles, everything has a little more stretch, a little less tone, and a little more trauma from the pregnancies before. So baby number 2, 3, and beyond, that round ligament tends to complain louder and more often.
These are the worst mistakes Black women can make when choosing an OBGYN, assuming they'll automatically prioritize your safety, ignoring the signs when they dismiss your concerns, and not having a plan to advocate for yourself. Sis, I've been there, and that's why I'm so glad I found the Mocha Maternity Survival Guide, Choosing the Right OBGYN. This guide gave me everything I needed to avoid those mistakes, from conversation starters to tools for assessing their care. It's the ultimate roadmap to make sure you're seen, heard, and protected. Don't take chances with your health. Get your copy today and make the choice that could change everything.
Now let's talk about relief, because you do not have to suffer through this. Here's what actually helps. Move slowly and deliberately. When you go from lying to sitting, sitting to standing, pause. Give your ligaments a second to catch up. Roll in bed with your knees together. This reduces the strain on your groin and pelvis. Use support. A maternity support belt can stabilize your belly and reduce ligament strain. I'll link my favorite one in the description below. Warmth helps. A warm bath, warm compress, or a heating pad on the sides of your abdomen can ease inflammation. Just avoid anything overly hot. Gentle stretching and prenatal yoga can open your hips, lengthen your torso, and relax your pelvic area, which can help reduce those sudden pulls. Using your birthing ball allows your pelvis to move without jerking motions. I'll link my favorite birthing ball below. Pain medicine is totally okay if needed. 2 extra strength Tylenol can be helpful if your provider has cleared it. Relax your muscles. I know, easier said than done, but tensing actually makes the pain worse. Deep breaths help reset that spasm.
Think about it. How many hands helped raise you? How many voices spoke life over you? How many arms held you close? Black family is deep, and at Melanin Maternity, we celebrate every single part of it. We're not just a shop for mamas. We're a love letter to the entire village. From keepsake birth announcements that honor your newest blessing, to new dad gifts, to presents for the grandma who still prays over you. We have gifts that tell your family's story. Looking for holiday gear that actually represents us? We got that too. Because whether you're the one having the baby or the one making sure the baby always has love, you deserve to be celebrated. Shop Melanin Maternity on Etsy today by visiting melaninmaternity.etsy.com. Because our families, our stories, and our legacies deserve the spotlight.
Now here's the part you don't want to miss. Round ligament pain should be related to movement. It should be short-lived. It should be a sharp or pulling sensation and relieved quickly with rest. If your pain is severe or constant, crampy in nature like menstrual pain, accompanied by contractions every few minutes, paired with vaginal bleeding, paired with leaking fluid, paired with decreased fetal movement associated with a fever, that is not round ligament pain. Those symptoms require immediate evaluation. Mama, I do not want you toughing this out in silence. If this pain is interfering with your daily life, impacting your mobility, or getting worse, talk to your OB provider. You may benefit from a referral to a pelvic floor therapist, a review of your posture or your sleeping position, or personalized strengthening exercises. Sis, you deserve comfort, you deserve relief, and you deserve a provider who takes your pain seriously. So here's what I want you to take from this. Round ligament pain is common, but you don't have to just deal with it. Your comfort matters, your mobility matters, your peace matters. And if you want to go deeper, to learn how to care for your whole self during pregnancy, come and join me inside the Melanin Maternity community, because your 15-minute prenatal appointment is not enough. You deserve a village, and we'd love to welcome you home at melaninmaternity.com. I'm Dr. Tiffany Woodis. Stay informed, stay empowered, and I'll see you next time.
Want to go deeper? The conversation doesn't have to stop here. Join Melanin Maternity, our digital Black birth community, where you'll get expert guidance, real support, and a sisterhood that sees you. From live Q&As with birth experts to empowering discussions with other Black mamas, we've got you covered. Click the link in the description and step into the community you deserve.